There's one hire in your private practice that quietly determines whether you scale to 7 figures or stay stuck where you are. Get this person right and your practice runs itself. Get them wrong and it costs you hundreds of thousands of dollars every year without you ever seeing that line item. And most owners have actually never defined what that job is supposed to look like. So they end up with someone who's great at managing chaos when what they actually need is someone who prevents it. There are 2 fundamentally different types of people who hold the practice manager title: coordinators and operators. Most practices have a coordinator when they need an operator, and that gap gets more expensive as the practice grows. So in this video, I'm going to give you the exact 5 metrics a great private practice manager owns, the one interview question that tells you everything, and a framework that lets you look at the person in your seat right now and know within about 10 minutes whether they're the one to take your practice to the next level. I'm Masterin, and this is Private Practice Secrets. Today's video is sponsored by Utilization. I've spent the last few years working with hundreds of private practice owners, solo PTs, multi-site behavioral health groups, primary care specialists, and the same operational gaps show up in almost every single one of them. So what I'm sharing on this channel isn't theory. It's actually patterns I see over and over and what practices that actually scale are doing differently. So let's start with the title itself, Practice Manager. It is one of the most inconsistently defined roles in all of healthcare administration. I've seen practice managers who are basically glorified schedulers. They handle PTO requests, restock the supply cabin, put out daily fires. And I've seen private practice managers who are functionally the COO of multi-million-dollar operation. It's the same title, but it's completely different jobs. The problem is, most practices define the role by what they need right now, not by what the business actually requires at scale. So when you hire someone to handle whatever is falling through the cracks today, and 3 years later, you're surprised the business has grown and the role hasn't. Or even worse, the business hasn't grown and the role has stayed exactly the same. Here's how I define what a great practice manager actually owns. And I want to be clear about the word owns. It's not helps with, not coordinates. It is actually owns. There are 4 domains. First is staffing operations, scheduling, coverage, onboarding, day-to-day HR execution, not strategic HR that usually sits with the owner or a dedicated HR function, but the operational layer of making sure the right people are in the right place every single day. Second is patient experience. From the first phone call to checkout, wait times, complaint resolution, front desk training, the actual experience patients have when they walk through your door. If patient satisfaction scores are going sideways, that is a practice manager problem. Third is operational compliance, and I mean process compliance. Are your workflows actually being followed? Is documentation happening on time? Are your operational systems running the way that they're supposed to, or are they kind of happening? And fourth, and this often gets missed, is financial visibility. Not financial strategy, but the practice manager should know at any given moment where you are against revenue targets, what your scheduling utilization looks like, and what the cost drivers are that they directly control. If your practice manager can't tell you your appointment fill rate off the top of their head, then that is a gap. So how do you know if the person in that seat is doing the job? You stop guessing, you start measuring. There are 5 numbers every practice manager should be accountable to, and every owner should be reviewing at least monthly. Let me walk you through them. Number 1 is schedule utilization rate. What percentage of your available appointment slots are actually filled? A well-run practice consistently is at 85% or above. If you're below that and you don't have a seasoned explanation, that's a scheduling or a conversion problem, and your practice manager should own this. They shouldn't just flag it, they should own the metric. Number 2 is staff turnover, and I want you to sit with this number for a second. MGMA data shows that replacing a single employee can cost anywhere from 50 to 200% of their annual salary. When you factor in recruitment, onboarding, lost productivity, 200% is very, very significant when you say it out loud. And this is what your practice manager should be directly responsible day to day. Turnover is a culture metric. Culture is an operational metric. Number 3 is patient wait time. 2 flavors of this. in-office wait, and time to first appointment. If a new patient is waiting more than 2 weeks to get in the door, you've got either a scheduling problem or a capacity problem. And both of these are operational, and both of them are fixable, and both of them your practice manager's job to surface. Number 4, and this one is almost one that nobody talks about, is your front desk conversion rate. Of every person who calls or walks in asking about your services, what percentage actually are on the books? I bet most people watching this won't be able to answer this right now, but it is 100% your practice managers within their sphere of influence. And if you cannot manage this, then you're leaking revenue every single day and you don't even know how much. Number 5 is documentation timeliness. What percentage of clinical notes are closed within the first 24 hours of the visit? This one matters for 2 reasons. First is billing. You can't bill what isn't documented. But second is audit risk. CERT audits and OIG work plans flag untimely documentation as a compliance vulnerability over and over again. Your practice manager should have eyes on this number every single week. Now, here's what I want you to notice about the whole list. Every one of those metrics is something your private practice manager can directly influence. So we're not asking them to run your revenue cycle or manage payer contracts. I'm asking them to run the operational engine of the practice. That's the main job. Okay, now I want to give you a distinction that will change how you evaluate anyone in this role, including the person you have right now. There are 2 fundamentally different types of people who hold the practice manager title. I call them coordinators and operators. A coordinator is reactive. They handle what comes to them. They're good at keeping things from falling apart. They're responsive. They're often well-liked, but their mode is fundamentally defensive. They're managing the chaos. They're not reducing it. An operator, on the other hand, is proactive. They look at the data before problems show up. They build systems. They ask, what broke last month and what do I put in place this month so it doesn't break again? They don't just solve today's problem. They make tomorrow easier. And here's the uncomfortable truth. Most practices have a coordinator when they need an operator, and that gap gets more expensive as the practice grows. A coordinator who works fine in a 2-provider practice becomes a bottleneck in a 5-provider practice. The chaos they're managing just gets bigger. So how do you tell which one you have or which one you're hiring? Ask this question. Tell me about a process you built from scratch in the last 12 months. A coordinator will struggle with that question or give you an answer about a form they updated. An operator will tell you about a system, a workflow, a tracking mechanism, a reporting cadence that they identified was missing and then built. That one question will tell you more about who you're looking at than almost anything else on a resume. Now, if you're in hiring mode or you're about to be, here's what I push you to think about differently. Write the job description around outcomes, not tasks. Maintain schedule utilization above 85%. Reduce time to appointment for new patients by 20% within 90 days. Build a staff onboarding process that reduces 90-day turnover. Now you're describing an operator role, and you'll get the operator applicants. In the interview, ask these questions. First, walk me through a metric you track that you didn't inherit from someone else, one you decided to start measuring because you identified it mattered. Here you're testing for data instinct and initiative. Second is, tell me about a time a process broke under your watch and what you did differently afterwards. You're testing for ownership and systems thinking by this question. If you're evaluating someone you already have, the same framework applies. Have the conversation directly. And here are the 5 metrics I need you to own. Here are the 5 metrics I'm going to use to evaluate how you are doing. Are you set up to track these? What do you need from me to hit these outcomes? That conversation alone, done well, is often enough to level up someone who had the capacity all along, but was never given a clear operating mandate. The practice manager role is one of the highest leverage positions in your organization. If you can get it right, then the whole business gets easier. And if you leave it undefined, it quietly becomes the most expensive source of chaos you have. So here's what I want you to do this week. Pull up a blank page, write down the 5 metrics we talked about today: schedule utilization, staff turnover, patient wait time, front desk conversion, and documentation timeliness. Then ask yourself one question. Does the person in my practice manager seat know what those numbers are right now? And if the answer is no, then that is your starting point. If this was useful, please share it with someone who's either trying to hire for this role or trying to figure out how to grow into one. Thank you for watching. I'll see you next week.